Okay, good morning. Here's the latest on the coronavirus as it pertains to us here locally. As of right now, HN is unaware of any local school closings. In fact, yesterday, while declaring a state of emergency here in Massachusetts, Governor Baker spoke specifically regarding K through 12 schools and said that the Department of Secondary and Elementary Education is providing local schools with relief from attendance and school year requirements so that the schools have the flexibility to make decisions on temporary closures due to coronavirus concerns. More specifically, the longest that any school district will be required to have classes is its scheduled 185th day. No schools will be required to be in session after June 30th. And for accountability purposes, this school year, the Department of Secondary and Elementary Education will calculate chronic absenteeism only up until this past Monday, March 2nd, 2020, and disregard all attendance data for the remainder of the school year. All districts are urged to cancel all out-of-state travel at this time. This is in addition to the administration's existing request for schools to cancel international trips. The Department of Public Health will be issuing updated guidance to superintendents on how to address cases that arise at a school, including potential school closures. The public is also reminded to take steps to limit the spread of the coronavirus. Cover your mouth. When you cough or sneeze, use a tissue or your inner elbow, not your hands. Wash your hands with soap and warm water or use alcohol-based sanitizing gel. Stay home if you're sick and avoid close contact with others. So what are the symptoms of coronavirus infection? According to the Cape Cod Hospital website, patients with confirmed infection reported fever, cough, shortness of breath, and difficulty breathing. If you suspect you're infected with the coronavirus, the CDC advises following steps to help prevent the disease from spreading to people in your home and community. Restrict activities outside your home, except for when getting medical care. That means do not go to work, do not go to school, do not go to public areas. Also, avoid using public transportation, ride sharing, or taxis, etc. Secondly, separate yourself from other people and animals in your home. Regarding animals, the CDC says not to handle your pets or other animals when you're sick. Call ahead before visiting your doctor. If you have a medical appointment or are making one, call the healthcare provider and tell them that you have or you may have the coronavirus. This will help the provider to take necessary steps to keep other people from getting infected or exposed. When to wear a face mask. According to the CDC, you should wear a face mask when you are sick or around other people or pets and before you enter a healthcare provider's office. Again, cover your coughs and sneezes. Avoid sharing personal household items that have not been thoroughly washed. Wash your hands often with soap and water for at least 20 seconds. And if soap and water are not available, clean your hands with an alcohol-based hand sanitizer that contains at least 60% alcohol. Also, avoid touching your eyes, your nose, and mouth with unwashed hands. Clean and disinfect all high-touch surfaces every day, like doorknobs, tabletops, and your cell phones. Monitor your symptoms and seek prompt medical attention if your illness is worsening. For example, if you're having difficulty breathing. If you have a medical emergency and need to call 911, notify the dispatch personnel that you have or you're being evaluated for the coronavirus. If possible, put on a face mask before emergency medical services arrive. That's just some of the current information available on the CDC website at cdc.gov. Check it out. Everyone needs to stay informed and vigilant in order to hopefully prevent rapid spread. Preventing rapid spread will hopefully prevent healthcare resources from becoming overwhelmed and depleted. Now, HN has reached out to a Cape Cod Hospital spokesperson regarding current protocols and statistics relating to possible local cases and testing, and we're still waiting to hear back, and we'll hopefully hear back soon. HN will provide updates from Cape Cod Healthcare as they become available. HN has also reached out to a communications officer with the Massachusetts Department of Public Health regarding current questions and future updates. Again, HN will provide official updates and information when it becomes available. And regarding current numbers, according to Johns Hopkins University, the total number of confirmed worldwide cases is currently 119,000 86, with 4,284 confirmed deaths, and with a total of 65,762 cases listed as recovered. In the U.S., there are a total of 1,025 confirmed cases with 28 deaths and a total of 8 listed as recovered. These U.S. numbers are expected to rise as more people are tested. Because of the severe impacts on the elderly and those with compromised immune systems, this developing situation is being taken very seriously, so stay safe and stay tuned. Reporting from in front of Cape Cod Hospital, it's Hyannis News.